Hi, everyone. My name is Sam Cardamone. I am the director in the Study Abroad office. And today we're going to be talking about study abroad in the time of COVID. We're going to be touching on how does the Study Abroad office at SUNY Geneseo make determinations to resume mobility. And we're also joined by my colleague, campus community resource nurse, Laura Evans. Laura, would you like to introduce yourself?
I think you just did, Sam, but
Perfect.
I am Laura Evans. I'm role is campus community resource nurse. I am one of the registered nurses that works in the student health and counseling department.
Excellent. And also joining us as both a facilitator and employee in the office, as well as audience for our session here today, is Abdel. Abdel, would you like to introduce yourself?
Yeah. Hi, everyone. My name is Abdel. From Morocco. I'm studying a master's in higher education student affairs at Nazareth College. And I am the study abroad intern at SUNY Genesys Study Abroad office. And welcome to all of you.
And Abdel will, for many students, if you're expressing your interest in study abroad, Abdel may be one of your first points of contact. Abdel meets with students to talk about their plans for studying abroad, do some program advisement, and also answers general questions related to program selection and planning. So we've got some slides that will guide us through our conversation here today. And Abdel and Laura, give me a thumbs up if you can see the screens there. Excellent. So I think one of the most important things, and one thing that I'll be mentioning throughout this video, it is February 11th at noon Eastern Standard Time. COVID is a constantly changing, evolving situation within the United States. Our response to COVID-19 has been continuously evolving, and different regions have been responding and having blossoms of cases. And even at the most local level within Geneseo, there are the situation around case numbers and things like that is constantly changing. So throughout this video, if you're watching this video at a date well beyond February 11th, 2021, please do contact the Study Abroad office for the most recent information. This information contained in this video is as we understand things today, February 11th, 2021. We don't have any students joining us live right now, so we're going to skip over the introductions because we've done them for our facilitators here. The goals today is to provide an update of where we are today. We're going to answer some of the following questions. How does the SUNY Geneseo Study Abroad office decide if it's safe to resume a study abroad program? What is the healthcare capacity in the place that I'm going, and where can I find that information? What will it be like in other countries? And obviously, as mentioned before, COVID is a constantly evolving situation. So we're going to introduce you to the places where you can find information, what it's like, and what can a student do to protect themselves from COVID-19 when traveling. And Laura is going to walk us through some of those individual health and safety strategies that a person can do to help promote good health. So where are we today? On January 28th, student provost in charge announced that after careful deliberation, the determination has been made that all university-sponsored student international travel is canceled for the summer 2021 term due to the ongoing pandemic. What does that mean for study abroad beyond summer 2021? The Study Abroad office is presently assessing programs for their resumption, and we are hopeful, fingers crossed, that conditions will improve such that students can go abroad in the fall 21 semester and beyond. That is something that is constantly evolving. And today we're going to talk about how do we decide if programs can resume. So the question I get most often from students is, when will study abroad resume? And as much as we would love to continue to add more photos to our photo contest and photos to our photo albums, the answer is we don't know. This is because COVID-19 is a constantly changing situation. And even if the United States is successful distributing vaccinations to 65, 70, 85, 90% of the population, that is not necessarily the case around the rest of the world. Vaccination distribution and inoculation is happening at different rates in different countries. Vaccination is one of those topics that is being very much widely discussed in study abroad circles around, is this a requirement? Is this a recommendation? We'll talk a little bit more about that. But vaccination certainly would help us, would contribute immensely to confidence in the resumption of study abroad. What's going on with COVID around the world? This is an excellent resource if you're unfamiliar with it. Johns Hopkins University has been following cases. There are many different sources of information where you can aggregate together data around COVID case data, but this one I think has been referred to by a number of reputable organizations. So we'll make these slides available as well, but if you click on this, this was screenshotted a few days ago. This was, as you can see, screenshotted about a week ago now, last updated January 27th. I know that this number is now into the 110 million cases and more. This also allows you to click around and get data on specific countries, as well as one of the things that's most useful very often is cases per 100,000 residents, because just the total case number is hard to decipher given the different population densities of different nations. But there are so many excellent resources out there. This is just one of them. This, along with, we're going to be talking about the CDC and the State Department and the World Health Organization as well. And that brings me right to the CDC and the Department of State. Where does the Study Abroad Office get its information about COVID? We rely generally on government organizations for their data. We do not tend to turn to news media, and sometimes news media does break the case maybe a day or a week or even a month before something is officially announced. But we generally rely on the CDC because the CDC are populated primarily with scientists and therefore require evidence-based declarations of information as compared to news organizations who rely on clicks and revenue. So we're going to be talking a little bit about sources of information later on as well, as it relates to how does Boeing feel about the safety of air travel compared to how does the CDC feel about the safety of air travel. But all of these links will take you to the CDC travel health notices. I would like to visit this one at least to show you how one of the major factors that the Study Abroad Office considers. So if you come here, this is the general landing page for the CDC travel health notices. Travel health notices is something that has been around as long as the CDC has been publishing information about other nations. What we're on right now are the travel health notices that are generally out there. So health infrastructure breakdown in Venezuela, polio in Asia. And then the CDC has created another dedicated page just for COVID-19 travel health notices. So if we open this page, this will talk to us just about travel health notices related to COVID-19. You can see here the scale that is used by the CDC, level 4, very high evidence of transmission. And what you'll notice through this quick scroll is that many nations, especially traditional study abroad destinations, are in level 4. This is all level 4. And it's not until we get to here that we start seeing level 3. Level 2 is even shorter, and very few countries labeled as level 1. But the Study Abroad Office also reports upward to SUNY, and we are right now determining what is the appropriate level for countries to allow study abroad to resume. Is it level 1 only? Is it level 2 and below? Is it level 3 and below? As of right now, and we're going to be looking at that matrix of those things in a moment here. The State Department also assigns countries a risk level, and it's also a 1 to 4 level. And the State Department has also created a COVID-19 specific information, and we're going to go right to that landing page here. The State Department primarily focuses on things related to your ability to move in a country, for example, whereas CDC focuses its efforts and mentality around health and what is the likelihood of transmission of COVID-19 and what is the likelihood of contracting the virus, whereas the State Department considers things like, if you travel to this place and you get sick or you don't get sick, what is the likelihood that you'll be able to enter or exit the country again in the future? What is the likelihood of terrorism and crime and other factors that influence their risk ratings? So COVID-19 country-specific information, this will take you to any of the countries you might be interested in studying, and we have a lot of students who are interested in our Austria-Vienna program right now. So if we open the Austria page, this will give us information from the embassy, which is in Vienna, and give the most up-to-date information about consular alerts, country-specific information, and as I mentioned, exit and entry requirements. Are you allowed to enter Vienna, Austria right now, or are US citizens not permitted? As well as things like movement restrictions, quarantine information, COVID-19 testing, COVID-19 vaccines. And one of the things that this page doesn't show it, but we'll talk about this in a few minutes. Also things like what happens if you violate local public health guidelines. So these are our sources of information. We also, the embassy page is what we just viewed. If you wanted to jump right to one of those embassy pages, if you type in COVID embassy and the name of the country you're interested in, usually it's going to be the first result on Google. So what is the process by which the study abroad can resume? There's a 3-phase program review and restart. Genesys, right now, we have our Ready, Set, Study Abroad series of information sessions going on. We are actively promoting study abroad, and we often get the question, should you be promoting study abroad right now? And the answer is, we're always promoting because we're always looking 6 months ahead. And 6 months from now brings us to August, and that's the start of the fall semester. So we believe it's responsible to promote it while also telling our students, we don't know if it's actually going to happen or not. So any student who's interested in the fall 2021 semester, we're going to be working with you very closely because this is an evolving situation. So please don't confuse, though, promoting study abroad for the fall semester does not mean that the fall semester programs are going to happen. That is the assessment that's going to happen over the next 6 months as we get closer to the month of August. We expect to make many fall program decisions around June 1st. That's the date by which we want to do a macro level assessment with the CDC and the State Department. And that's what we're going to show you right here next is the timeline. So the fall semester, we expect to review the Department of State and CDC travel risk warnings, the ones that we just looked at on the CDC website as well as the State Department website. And phase 1 begins with consulting the State Department and the CDC. And if either the State Department or the CDC is at level 4, that is an instant cancellation of the program. Level 4 is the highest risk warning. If the country is rated below level 4, on the review date, the program will proceed to phase 2. This could change. As I mentioned, the criteria by which a program is permitted to reopen or not reopen is being discussed right now between campuses like the Genesys campus, as well as working with our colleagues who are headquartered in Albany. It's called the SUNY Office of Global Affairs. Also, I may abbreviate that as SUNY OGA. You'll also see the other terms. Winter term, we intend to review, do phase 1 review on October 15th. Spring, also October 15th, and summer, March 15th. How did we arrive at these dates? Semester programs are long duration programs, and they usually require a visa. So June 1st is about 90 days or 3 months before the major launch of most fall programs. 90 days allows a student enough time to purchase a flight as well as to acquire their visa. Winter and summer programs are generally shorter duration, 3 or 4 weeks, and generally don't require a visa. So October 15th is about 60 days or 2 months before the start of the summer term, which the summer term generally starts in the middle of May, beginning of June. Same is true for the winter as well. October 15th, 2 months later, December 15th, that's right before we would start sending students abroad for the winter programs. So this is the risk matrix that I mentioned. If the CDC country-specific COVID warning is at a level 1 and the Department of State country-specific is at a level 1, we are going to proceed to the program-specific review, and we have high confidence that the program actually has the possibility of launching. If it's at level 2, we will proceed to the review with OGA. The confidence that the program is going to happen decreases a little bit. CDC level 3, anything at the level 3, very low confidence that the program is actually going to operate. And you'll notice even less confidence when it's a level 3 for the CDC and a level 3 for the Department of State. Anything in the level 4 is going to be an instant suspension of that program. Next phase, Geneseo review. We collect information from the universities abroad. We want to know, does the university where our students will be studying, do they have the capacity for testing? Do they have the capacity? Do they have protocols in place as it relates to social distancing? Are classes delivered in person, or are classes delivered online, or are they hybrid? All of this information is gathered in the phase 2 review. Phase 1 and phase 2 actually happen concurrently. We are gathering that information from those universities right now in the 6 months leading up to the fall semester. The data each partner submits a questionnaire answering a lot of different questions, also around quarantine requirements. And we also are trying to gather as much cost information. One of the major factors when students are considering studying abroad is the cost. If I have to do a quarantine, is the cost of quarantining my responsibility, or is it the cost that I pay to the university? Or is my quarantine covered by the government of the country that I'm going to? So that's all the information that we're gathering in this phase 2 review. And we will pass that information along to students as soon as we have it available to our office. This information is consolidated, and the study abroad office at Geneseo then makes a determination if we think, as the professionals responsible for the operation of study abroad programs, we decide if we'd like to make a recommendation to the SUNY Geneseo leadership to proceed. And it is then that the coronavirus incident leadership team makes a decision whether or not Geneseo will proceed with a study abroad program. This is done program by program, country by country, because even in the same country, could you have very different case transmission city by city. So we focus it not just on the country level, but even on the city and university level. And finally, all of that data that's pulled together, all of that rationale to operate a program gets submitted to SUNY Office of Global Affairs. OGA does their review because ultimately the decision makers are Geneseo, but also SUNY at the Albany level. What about the vaccine? Is it recommended? Is it required? The staff of the SUNY Geneseo Study Abroad Office are not health professionals. We defer to the health guidance generated by the CDC. At present, the CDC strongly recommends getting the COVID-19 vaccine, and the Study Abroad Office agrees. If you are a person capable of receiving the vaccine, and I say capable because there are folks who have allergic reactions and other comorbidities that would prevent them from receiving the vaccine. But if you are a person who is capable and you intend to study abroad, we strongly recommend that you follow the guidance of the CDC and receive the vaccine. SUNY is discussing the possibility of making this a requirement for study abroad. But as of today, February 11th, 2021, this is now just simply a strong recommendation. Who decides if a study abroad program gets suspended? Well, it could be the foreign institution abroad. It could be SUNY Geneseo. It could be the Office of Global Affairs in Albany. It could be the SUNY Chancellor if the leadership of SUNY decides that that's the right course of action. It could be our state government. Governor Andrew Cuomo has that decision-making power as well. It could be our US federal government saying no outbound travel or no outbound student exchange. Or it could be the government of the country where students are going to study, of the partner institution. It could be that France decides, no, we will not allow student visitors to come in for one semester study. So there's a lot of different decision makers built into study abroad. And the study abroad office, our responsibility is to keep students informed about those decisions that are being made. And how are public health guidelines different abroad? This may be the most controversial thing that I will say on this session here today, but within the United States, with the exception perhaps of New York City and other parts around New York City, the United States has not really experienced lockdowns with immediate potential violations of the law. And by that, I mean, living where I do in Rochester, New York, and around the Geneseo area, if a person is outside walking their dog without a mask, and that is observed, there generally has not been any fines for behavior like that, and there also has not been any jail time for behavior like that. If a person violates their quarantine requirements, that is punishable, but that may not actually result in any kind of fine or jail time. This is different country by country. The public health measures and consequences vary by country. And so what I've collected here are some examples to illustrate this. Movement restrictions. Are there restrictions on intercity or interstate travel? In South Korea, the answer is yes. There are no restrictions on domestic flight travel in Korea. However, those entering Korea from abroad will not be permitted to board domestic connecting flights, for example. So if you are coming into Korea and then you're flying into Incheon, which is in Seoul, and then continuing to Busan, you must first complete a government mandated quarantine, for example. Also in South Korea, people are required to download on their smartphone a QR-based access to facilities. And Korea has a QR-based registration system to allow people to visit restaurants, clubs, and other entertainment facilities. You need to show that you are behaving appropriately and that you are not a high risk for COVID-19 transmission. So there are significantly different requirements around engaging with the larger public in other countries. In Ghana, for example, at the Accra airport is open for regular international passenger travel, but Ghana's land and sea borders remain closed until further notice. This is important for a student who's going to go spend a semester in Ghana. If you arrive in Ghana, the airport is open for an international arrival, but if you want to venture out of Ghana through a land border, you will not be permitted to do so, nor re-enter Ghana through a land border. And is a curfew in place? In Spain, the answer is yes, and that depends. This is where local municipal decisions, what we have here is information at the government, the country level, but each local government has decisions to allow curfews in Spain. And again, in Rochester, New York, not familiar with any curfews that have been implemented as a result of COVID-19. What happens if I don't follow the rules? The example that was most in the news recently was a person by the name of Skylar Mack. They're a college student who went down to the Cayman Islands. They violated their precautionary quarantine. In the Cayman Islands, when you arrive, you're given a wrist or ankle bracelet to track your movement. This person, Skylar Mack, removed the bracelet and after only 1 day completing quarantine, and was sentenced to 32 days in prison. This is my greatest concern for students traveling abroad, is that in the event that you violate public health guidelines, there is nothing that the US government or the SUNY Geneseo College can do for you to advocate for your release. So if you do violate local laws, and local laws include public health guidelines, you will be held responsible for that. And for example, in South Korea, beginning in October, face masks are compulsory in public places. That's on public transportation, healthcare facilities, and failure to wear an appropriate mask that covers both the nose and mouth could result in a fine of up to 100,000 won, which is about $100 US. You can see the other examples there. Jumping down to Ghana, not wearing a face covering in public could result in a fine of 12,000 cedis, up to 60,000 cedis. So anywhere from $2,000 US to $10,000 US and or a prison sentence of 4 to 10 years. So the enforcement of public health guidelines is taken very seriously in other nations. And in Spain, for example, non-compliance may result in arrest and in fines that range between €60 to €60,000, up to 72,000 US dollars, depending on the gravity of the violation. Ultimately, it's important to understand that violations of public health measures have a wide range of consequences. What about flying? Is that safe? The CDC put out a statement about air travel. Air travel requires spending time in security lines and airport terminals, which can bring you in close contact with other people and frequently touch surfaces. Most viruses and other germs do not spread easily on flights because of how air is circulated and filtered on planes. However, social distancing is difficult on crowded flights, and sitting within 6 feet of others, sometimes for hours, may increase your risk of getting COVID-19. How you get to and from the airport, such as the public transportation and ride sharing, can also increase your chances of being exposed to the virus. This is the official position of the Study Abroad Office, because this is the official information from the CDC. I'd like to contrast that to something that was recently put out by the Boeing company. Boeing is the company that makes many large aircrafts. And this was in a presentation delivered on January 14th, the following slides. Relative risk of air travel. When traveling by air, you are much less likely to contract COVID-19 than in everyday life. I don't see any sources cited on this slide. This is a very broad statement that I would really, if I, as a discerning person of information, I'd like to know, where is the evidence that supports that statement? There are very few reports of transmission in the air travel journey based on a 2020 travel report. One of the things that has been most contested is the effectiveness of contact tracing. And it is, to my knowledge, it is only through contact tracing that they could successfully make a statement like this. And we know that the contact tracing has been very difficult, as many people are not forthcoming in their disclosures of who they were around and did they have any knowledge of their own symptoms. So this, again, is a very would be a very reassuring statement if there was more evidence to support it. Now, this is the one thing that I think that the CDC does make mention of, is that the in-flight recirculation of air has been affirmed by the CDC to be pretty safe, though they do talk about the proximity. The CDC emphasizes that it's hard to remain distanced when you're in an air cabin. So this sentence talks about, or this slide does an emphasis on the cabin airflow is refreshed every 2 to 3 minutes, and people are expected to wear face masks. All things that definitely do reduce the risk of transmission. But again, Boeing ends with a slide: when traveling by air, you are much less likely to contract COVID-19 than in everyday life. A difficult statement to say, a difficult assertion to make without data that supports it. The air in the cabin is exchanged much more often than in other indoor spaces. I definitely think that there is evidence for that. The cabin environment creates the equivalent of over 2 meters, over 7 feet of physical distance between every passenger on a full flight. I've been on a full flight. I don't know how that statement is true. On a full flight, I have never had 7 feet of physical distance between me and every other passenger. So I show these slides as evidence that there are different motivations by different organizations. And this, again, goes back to, where are you getting your information from? And the Study Abroad Office strongly recommends that you get your information from the CDC and the State Department and other trusted, primarily government organizations. I'd like to turn it over now to Laura Evans to take us through, how can you individually stay healthy?
Well, I wanted to start with the slide that Sam has up here. This is ultimately, CDC is evidence-based regulations that healthcare professionals utilize when you come in to have a consultation about your travel. Also, as he has presented, there's a lot of work that goes behind keeping you safe, but ultimately, you have a part to do in this, as well as keeping yourself safe during your travel experience. At this time, You're probably going to hear this over and over. CDC recommends not to travel domestically or internationally because of the risk of COVID-19. If you're sick, if you've been exposed to somebody who's had COVID or you've had positive COVID, you should not travel. All air passengers, if they are going to travel, will need to provide a negative or an already recovered documentation before they board. As of February 1st, any travel, for example, if you're getting on the bus, if you're going on the subway, you are now required to wear a mask, and there are some fines relative to that as well. So basically, we want you to consider your activities and the risks that they will pose to yourself, as well as, you know, somebody you may live to and might be coming back to after your travel. So as Sam has said, the air travel is, it's more than just sitting in a plane with some filtered air. There's a lot more to it. There's a transportation to the airport. There's standing in terminals and in lines. So social distancing is pretty difficult to impossible to maintain that 6 feet. So on the next couple slides, again, from the CDC, that's pretty much, we kind of call it our Bible for lack of better terms, is the masks, which has been some controversy just in general. They really have been proven with the research that they are helpful to protect you and me. So it's a two-way street. So the second portion of this is basically a poster that can be seen on the CDC, and it tells you, you know, wear your mask, avoid crowds, stay 6 feet apart, and wash your hands. We hear this around locally. You hear it for international travel. Just in general, those 4 things are extremely important relative to keeping, again, you and others around you safe. The Study Abroad Office, in collaboration with many other offices and agencies, are carefully monitoring what will be safe and when to restart the study abroad. But again, having you take your part and make sure that you do your planning ahead of time, whether it's in COVID time or outside, no COVID, planning ahead is extremely important. One of the things that we try to ask you is for you to be honest about your physical as well as behavioral health before you travel. There are some things, just because maybe you have a medical condition or you may have depression or anxiety, it doesn't mean you can't travel. It just, we need to plan for it and help you make this the best experience that it can be for you. Always check the specific destination for health advice. At least 1 month before you travel, schedule an appointment with your doctor. You can also schedule with the providers at health services here at the college. There's no additional fee. You can schedule. It's a confidential visit. It is not something that gets reported back to study abroad. It's between the provider and you. But again, it's meant to be specifically for you to look at your overall health and well-being. Travel insurance is something that will come up when you do your study abroad. Currently, right now, it's a United Healthcare product, and there are a lot of ins and outs related to that, but they can help you if you get sick while you're there to get an appointment and have coverage. If there is reason for emergency evacuation, they can help with that as well. A number of other things that, again, this is, I'm looking at the bigger picture, not just COVID related, is it would be a good idea for you to sign up for this Register for STEP, which is a Smart Traveler Enrollment Program, as well as check in with the U.S. Foreign Embassy. For example, some people take medications and they may not be permitted in the places that you're going. So packing a first aid kit, taking your medications, potentially taking extra medicine. If you wear contacts, packing extra of that. clothes for all types of weather. Basically, the best experience for you is going to come down to something that you've thought about and you've planned ahead. Again, need to consider your physical and behavioral health, your overall health and safety, where you're going, your environment, and your activities. One thing that I definitely like to remind people is do not forget, if when you come back you're not feeling well and you have to go to a provider, whether it's your doctor, whether it's urgent care, make sure you let them know that you've traveled. It could be a very important piece of putting the puzzle together of what you have and how they need to proceed. Probably the biggest thing that I can say is, again, plan ahead. Make sure that you're looking at how well you know where you're going and what you potentially will need, and just be honest with yourself and talk to your doctor.
Laura, thank you for that advice. Hitting on a lot of the things many of the things that Laura is talking about here are also for students who are going to be going abroad in the future, also contained in our pre-departure orientation, and that is a major step in the process of reducing risk. Study abroad before COVID, after COVID, during COVID. Study abroad has always had risk. Our responsibility in the Study Abroad office is to help mitigate risk, to identify foreseeable risks, and to encourage students, to provide information to students to help them make good decisions. Many of the things that Laura is talking about ultimately resides with the decision making that a person does or does not do. Because in many instances, when a student studies abroad, especially for a semester, there is not someone from SUNY Geneseo who is traveling with you to ensure that you're following the best guidance. So it really is up to the student themselves to take these things to heart and make them a part of their regular routine. And speaking of risk tolerance, this is something that the Study Abroad office talks about all the time as it relates to the launching of programs. Does this knowing specific risks are part of a program, do we still want to proceed or not? We do that at a program level in the Study Abroad office. We invite students to do that at an individual level. So the Study Abroad office at Geneseo worked with a number of other Study Abroad offices across the SUNY system, and we've created a 10-question questionnaire. It is a self-assessment for students to ask themselves, as an individual student, what's my risk tolerance? What am I okay with? What do I feel comfortable with? What aspects of ambiguity do I feel comfortable with? Because studying abroad, while COVID still impacts the entire world, there's going to be significant ambiguity. There's going to be constantly changing circumstances. There are going to be new restrictions imposed in different places. So understanding where an individual student has their own assessment of risk tolerance is really important. This is just question 1. It says, in general, how do you feel about the potential health ramifications of contracting COVID-19 at home or abroad? If the thought of getting sick with COVID-19 makes you very, very concerned or moderately concerned, or, I don't feel particularly concerned, I feel moderately concerned, or I feel very concerned, that allows you to begin that journey on deciding, is this something that I'm ready to do? Because when you think about getting sick, especially if you're in another country, there's going to be a whole new healthcare system to navigate. And many of your normal stakeholders' supports, whether that's parents, guardians, partner, are maybe not going to be as readily available. So this URL or this link, what is your risk tolerance, will take you to a Google form for a student to be able to see all 10 questions and submit their assessment of their own risk tolerance. So I encourage you to do that, watch this video, and then certainly take your own risk tolerance to understand where do you identify, and then you calculate your results and it'll give you a recommendation. Either you have a low risk tolerance, a moderate risk tolerance, or a high risk tolerance, and there are recommendations associated with each of those. Normally, this would be the time that we'd ask people if they have questions. We don't have anyone joining us right now, but if you do have questions, we want you to know that those are still able to be answered. You can contact the Study Abroad office. There is our website. On our website, there is a yellow banner near the top that has information about study abroad and COVID-19. That has many frequently asked questions. So I would encourage you, if you have a question about how to study abroad, how does COVID impact study abroad, I'd check there first. If it can't be answered there, send us an email, studyabroad@geneseo.edu, or pick up the phone. We'd love to talk to you. Give us a call, 585-245-5546. We're located at Irwin Hall 217. We are primarily only doing meetings by video conference right now. The staff is not doing in-person meetings in the office. You can also follow us on Facebook and Instagram to stay up to date around promotion information as well as health information. And Laura, would you like to talk through the information that you have there?
So you can find some information, general information about the CCRN, which is Campus Community Resource Nurse, the role that I hold. If you have specific questions, by all means, send me an email. That's evansl@geneseo.edu. My phone is listed there as well. Please feel free, if you do not get an answer, to leave me a voicemail. I will get back to you. Currently, I am filling the role in the South Village Health Center, which is in Onondaga. I also have a solo office in Onondaga 203, which I work out of on Fridays. Our Facebook page, it is Health and Counseling. That's the general page. I also have an Instagram, which you may have seen that we promoted this program today. But it's CCRN Assistant. It's more health related items. But yes, feel free to connect with us any way that you feel comfortable with.
And if you are interested in studying abroad in the future, as I mentioned, this is one event that's part of the Ready, Set, Study Abroad series of events. And if you you'll see the URL here, geneseo.edu/study_abroad/ready, set, study abroad, or into Google, Geneseo, Ready, Set, Study Abroad. This should be the first hit. This will take you, clicking on this screenshot will take you right to the full list of all the events that we have coming up: February 11th, February 12th, February 13th, 16th, 17th, 18th, 19th. And we will be talking about individual specific programs. You'll see, for example, Trinity College Dublin will be discussed on February 18th at 3:30. These are all going to be virtual events. We invite you to join for those if you are available. And if you've watched this video, we invite you to complete an event evaluation. That just gives us a little bit of feedback. Did this presentation around study abroad in the time of COVID, did it answer your questions? And if there are still questions going on, there's instructions on how to reach out to us and pose those questions. This is obviously the most important topic for a lot of students when they're thinking about studying abroad, is what is going to be the situation related to COVID. And we want to make sure that students have as many opportunities to ask those questions as possible. So please complete an evaluation. When this video is posted, this PowerPoint, the Google Slides will also be available, and you'll be able to click on that and link right to it. So that concludes our discussion of study abroad in the time of COVID. We want to thank you so much for sticking it out and listening to all the information that we made available. Special thank you to Nurse Laura Evans for spending some time with us and talking about how a student can reduce their risk and promote their good health. And if you have questions, contact the Study Abroad office and contact Nurse Evans, and we will be very happy to help you. We want to see a resumption of student mobility, but we want to see it done right, and we want to see it done safely. So this last, invitation is also another big stakeholder for students traveling abroad is parents and guardians and loved ones. So we invite you as well to work through your student. If you have concerns about them studying abroad, talk to them, and we invite students plus whoever the stakeholders are to speak with us together. We always think it's important that if stakeholders are going to be family stakeholders, loved ones are going to be involved, we'd like to have the student there as well. But the study abroad office staff is very happy to speak to students plus their relevant stakeholders whenever it's possible to do so. So thank you all once again, and wish you all very well. Take care. Bye-bye.